Chapter 33 covers adrenal glands, and when I look at our test map, Chapter 33 has 2 questions. They're both multiple choice. One's for extended use of these medications, and one has to do with labs. So keep that in mind when you're looking at this chapter. There are several terms here that you need to understand because of how they use them within this chapter. I'm pretty sure you can read through these, but I've highlighted the ones for you to understand. Note that there are 3 different corticoids, so corticosteroids, glucocorticoids, and mineralocorticoids. So review those 3. Know your catecholamines of epinephrine and norepinephrine. And then I think just Addison's disease, adrenal crisis, and Cushing's syndrome are the things that we'll see within this chapter. When we're looking over the main chapters, I'm not going to ask about the 2 distinct parts of the adrenal gland, but do understand that the adrenal glands are made up of the adrenal cortex and the adrenal medulla. The adrenal medulla secretes the catecholamines of epinephrine and norepinephrine, and the adrenal cortex secretes 2 types of corticosteroids, the glucocorticoids and the mineralocorticoids. Those corticosteroids are synthesized as needed, so they're not stored like the other mineralocorticoids. The mineralocorticoids get their name from the fact that they play an important role in regulating mineral salts, such as electrolytes, in our body. In humans, the only physiological important mineralocorticoid is aldosterone, and its primary role is to maintain normal levels of sodium in the blood. We've gone over lots of sodium and where sodium goes, water goes within our course. And it does that by causing sodium to be reabsorbed from the urine back into the blood in exchange for potassium and hydrogen ions. It not only regulates my blood sodium levels, but it also influences potassium levels in the blood and blood pH. The glucocorticoid that's predominantly affect the metabolism of carbohydrates and to some extent proteins and fats are the glucocorticoids. Cortisol is a major natural glucocorticoid. Oversecretion of our or hypersecretion of our adrenocorticoid hormones can lead to a group of signs and symptoms called Cushing syndrome. That was one of the things we saw at the beginning of the chapter. In Cushing's syndrome, this hypersecretion of glucocorticoids results in a redistribution of fat from the arms and legs to the face, shoulders, trunk, and abdomen, which leads to a characteristic moon face and humpback. If you want to Google that, Cushing syndrome, you'll get some good pictures that will help solidify that in your brain. Other symptoms can include hirsutism, so weird patterns of hair growth, usually on the face, ecchymosis or bruising, hypertension, hypokalemia, which remember our values on that, hypernatremia, remember our values on that, and then abnormal glucose tolerance and muscle atrophy. The undersecretion or hyposecretion of our adrenocorticoid hormones results in a condition known as Addison's disease. This one's associated with decreased blood sodium and glucose levels, increased potassium levels, dehydration, and weight loss. A combination of a mineralocorticoid and a glucocorticoid is usually used for treatment of Addison's disease. Okay, got us through that very top part there. When we're looking at our medications that we're going to take here, I want to talk about our naturally occurring mineralocorticoid aldosterone, which affects electrolyte and fluid balance by acting on the distal renal tubules. It promotes sodium reabsorption from that nephron into the blood, so it pulls water and fluid along with it. In doing so, that's going to cause fluid and water retention, which we understand. That leads to edema and hypertension. It also increases urinary excretion of potassium and hydrogen via the kidneys. The glucocorticoid drugs hydrocortisone, called cortisol in its naturally occurring form, and cortisone have some mineralocorticoid activity, and therefore they have some of the same effects such as aldosterone, which would be fluid and water retention. However, their main effect is the inhibition of inflammatory and immune responses. Glucocorticoids inhibit or control the inflammatory response by stabilizing cell membranes of inflammatory cells and decreasing permeability of the capillaries and decreasing migration of white blood cells into those already inflamed areas. They may lower fever by reducing the release of interleukin 1 from white blood cells, and they can also stimulate erythroid cells, which eventually grow up and become red blood cells. The glucocorticoids also promote the breakdown of protein and the production of glycogen in the liver and the redistribution of fat from peripheral to central areas. In addition, they have the following effects on various bodily functions. They increase blood sugar. They increase the breakdown of proteins to amino acids, and they stimulate bone demineralization. These drugs are indicated, let me scroll down here. These drugs are indicated for a huge, wide variety of note, things that we all note here. They're all in bullet format. Read through those and have a kind of an understanding, or at least where you can recognize those issues. Our contraindications for these drugs would be drug allergies. Also, if I have mental health problems, we want to use it very cautiously in patients with diabetes, as one common adverse effect is that it increases blood glucose levels and causes hyperglycemia, which often requires insulin, even if they didn't require that earlier. Let's see. Because of their immunosuppressant properties, glucocorticoids are often avoided in the presence of serious infection, including septicemia, systemic fungal infections, and varicella, which is chickenpox. Some adverse effects on page 521, table 33.4 are noted here. Pay attention to the general overview there, what they're telling us. Interactions, let me scroll down. I have some interactions here that are listed in bullet form. So non-potassium sparing diuretics, such as my furosemide we mentioned last week, aspirin, corticosteroids, which can inhibit the immune response and can reduce the hypoglycemic effects of anti-diabetic drugs, which can cause elevated blood glucose levels. Drugs of choice here. Let me scroll down.